How many of you have ever watched the TV show Grey's Anatomy? Well, as much as I would like to make this speech about McDreamy and his fluffy hair, I guess I better make it more educational. For those of you who don't know, Grey's Anatomy is a dramatic TV show that provides a glimpse into the medical field. Push one of epi, BP is dropping, clear! As a bystander in the hospital, these phrases meant nothing to me. But to the patient lying on that gurney, it meant life or death. Until you or a loved one has been admitted to the hospital, you never realize how hard these healthcare providers work or how much skill is required for their job. Since these surgeons, doctors, and nurses literally hold the lives of patients in their hands, attaining a job in one of these professions is extremely difficult. Throughout my speech, you will learn about a registered nurse's unwavering determination, loving personality, and resilient mentality. Let's begin by looking at the determination that is essential to become a registered nurse. As I mentioned earlier, attaining a nursing degree requires an unrelenting process of determination. The first step to acquiring a nursing degree is to study diligently. Yes, that means instead of binge watching a favorite show on Netflix, a pre-nursing student must force themselves to get out of bed and successfully prepare for exams and complete assignments. Also, pre-nursing students spend countless hours in the library researching to gain a better knowledge of their studies. Once all of the prerequisite courses have been completed at the college, the student will then apply to the nursing program. Clinicals will provide the nursing student with an opportunity to work in a local hospital under supervision. During clinicals, all of the classroom skills learned will be applied on an actual patient in the caregiving facility. The nursing student must focus on developing medical skills such as listening to a heartbeat using a stethoscope for abnormalities, and examining the systolic and diastolic blood pressure levels by using a blood pressure cuff. Nursing students must also prepare for the NCLEX RN exam. The NCLEX RN is an extensive exam that assesses every skill, medical term, dosage calculation, and much more that has been learned over the course. Excessive determination is required to train for this exam because without scoring a high grade, a license will not be issued. Now that we have talked about the determination, let's turn our focus to the personality traits a registered nurse must exhibit. The first thing most people notice about a nurse when they are being escorted to their patient room is the personality and the greeting they receive. Say you have a cold and go to the local doctor's office to receive a prescription and steroid shot. Would you rather be greeted by a grumpy, irritable person that clearly doesn't want to be there, or by an energetic, bubbly person that actively listens to what you are saying? I know which one I would pick, and I'm sure you would pick the same. Since a nurse's personality plays such a big role in the duty of the job, nurses must push aside personal battles to make the patient the central focus. According to Diane Ellie 2012 in the Journal of Advanced Nursing, caring is a characteristic associated at least initially with one's entry into the profession. When a nurse is down in the dumps or depressed, they must not allow it to interfere with the atmosphere created between patients. Even when a nurse feels sick to their stomach or develops a migraine, they must push through the pain and step into the patient's room with positive vibes. In 2003, Asa Sand claims that the personalities and qualities of nursing personnel are considered to be of great importance for their interactions and nursing relationships with patients. Last but not least, let's take a look at the mindset that is necessary to become a nurse. Being mentally tough is one of the most important attributes of a nurse. A steady mindset is required from day one through every exam, every hour at clinicals, and every patient's diagnosis. Nurses face constant battles and defeats along with a feeling of helplessness when a patient dies inevitably because there is no further treatment available. Each patient that passes away leaves a lasting impression in the nurse's mind, and a tough mentality must develop to overcome this situation. A nurse must also be able to take criticisms without taking offense or becoming emotional. Nurses undoubtedly face criticisms from instructors, bosses, and even patients. Maintaining a positive, resilient mentality will turn these criticisms into building blocks of strength. Gwen Sherwood and Meg Zamadori 2014 state that nurses can learn from experiences to synthesize and apply knowledge in advancing their practice. So no matter how many times you've watched Grey's Anatomy and think about choosing a career in the medical field, just think about everything that it takes to become a nurse. Sleepless nights spent cramming for exams, sacrificing time to attend clinicals, developing a nurturing personality, and developing a mindset that can withstand harsh conditions are just a few insights to the challenges that nurses face daily. Now that you know some of the characteristics of a registered nurse, you may decide to dive into this career wholeheartedly like me. Or you may decide to run as far away as you can get from this career.